Illinois is now dealing with high levels of respiratory illnesses, and it's serious.
Rates of COVID, flu, and RSV are on the rise, and that's across the state. Marissa Perlman's live in our newsroom with the new numbers and how we can keep our families safe. Marissa.
Good morning to you both. Yeah, if you at home have noticed a lot of people around you coughing or sneezing or getting sick, you are not alone. And it's not just here at home either. Emergency department visits across the country are now on the rise. But here in Illinois, 21% of ER visits in the last week of December were all for respiratory illnesses. That's up from 17% just the week before. In that same time, the number of flu-related hospitalizations more than doubled. The Illinois Department of Public Health expected the jump because of low vaccine rates. More scary data, too. Illinois is also seeing a rise in ICU admissions because of RSV, largely driven by kids ages 0 to 4. So far this season, 4 kids have died from illnesses here in the state. The CDC says Illinois just one of 36 states with high or very high levels of respiratory illness activity.
Over the last week, it started reflecting in our hospitalizations and admissions, where it starts to become challenging to our staff.
Now, health officials say this increase isn't a surprise, given that this is the typical season for spikes of respiratory illness. But it's not too late to get the flu, COVID, and RSV vaccines. Other effective tools we know about: good hand hygiene and ventilation. Health officials now recommend visitor restrictions and masking at doctors' offices and hospitals, too. Live in the newsroom, Marissa Perlman, CBS News Chicago. Jim?
Thank you, Marissa.